Good morning, I'm Brandy and I'll be explaining our Equinus boot today, also known as the EQIQ. This boot is only meant for stretching and you cannot walk in the boot. The reason for that is you will be using this lever in the back, which allows you to move this portion up and down. This portion will then lay right across above the knee. When applying this boot, there are multiple Velcro straps that go along the boot. The top two, you do have to feed through the foam and through the plastic and wrap around the leg, as I will demonstrate here shortly. Alrighty, as you see here, all the straps are now undone to where we can adjust this to our particular client and their specific needs in regards to the length. Like I said before, you will pull the lever up so that it allows you to move this back portion up and down, and we will then demonstrate here on our patient. You want the patient laying as flat as they can and make sure that the heel is able to be slid all the way back into the boot to where you could squeeze a little bit and feel right in there. As you see here, I did get it at a perfect length where it is kind of right above the knee, right below. So that first strap should come right across. Best advice, if you are at home alone, I would start from the bottom, working your way up, as it kind of straightens the leg forward and you won't be able to bend at all. So going through each groove, you're going to just start at the top. Make sure those are in the center where the patient is comfortable and wrap around. You will continue this all the way up. As you have everything strapped, the type of stretch you are looking for is the pulling from the calf all the way down into the toes. So if you were to simply, another way to explain is get a towel and pull towards you, your toes towards the ceiling. Feeling that pull right in here is what you are looking for. While wearing this boot, there is different nodules here that you see here on the side. When beginning, you start at level 1. We do incorporate some tools that will allow you to move steps forward as you progress with this treatment. When starting off, you will be wearing this boot an hour each day. Whether you break it up in 2 30-minute increments or sit for a whole hour is completely up to you. You will remain on this first level for about 2 to 2.5 weeks. Once you no longer feel the stretch, you will then come into this little handy dandy bag we include, which has an Allen wrench in here, which will allow you to simply unscrew and rotate the boot back and forth, as I can show you here shortly. There's some other parts that come along. This is an optional use wedge, which will directly just go under the big toe of either side. Get more in there. Right in there to elevate the stretch. I wouldn't incorporate this until about 2.5 weeks. If you are a little bit more sensitive and having more irritation with that wedge, like I said, it's optional use. You can just simply remove it and no longer use the wedge. Also in our pamphlet, or our little bag here, we include a pamphlet that kind of gives you some information in regards to what the EQIQ is, as well as some good visuals from the company. They give you visuals throughout the pamphlet here, explaining how to apply the boot to the affected area and how long you would be sitting in the boot. If you're not well with visual or verbiage, you can also use this QR code, scanning it with your mobile device to find any video to help you apply the boot as well. Last thing I didn't talk about is this little blue padding that also is in the packaging. This is just an extra blue padding that you see along the boot if you ever want to change any of those. Alrighty. So now I'll go ahead and remove the boot off, and I will kind of show you how we can maneuver the foot back and forth. Now I'm just reaching back in for that Allen wrench so that we can go right ahead and maneuver to the next level as our patient has concluded the first round of stretching. So here, either side, you can put those grooves into the screw here, simply screwing it off. Perfect. As both of those areas are no longer with the screw, you do have to separate the boot just a little to where that little space is created. Then you are to get both sides and kind of slide back. I could perform that action one more time. So off of the grooves, straight back. You're then going to make sure that both sections here are on the same side. Same level, same point on each side. Now you can see that we're not at a full maybe 90, but it is kind of increasing that stretch higher and higher up. So then after placing those in the proper nodule, you'll then rescrew these screws back into its place. Then finishing out with the Allen wrench. Of course, you will repeat screwing this side into this side. You want the screw tight enough to where it's gonna hold the position, but not tight enough to where you cannot remove it back out. So perfect, both sides are there. Now patient is ready to get back into the boot and start second round of our stretching for the next 2.5 weeks.